others. So we really appreciate that, Dr. Profena. Full medical staff, we're doing CME. Dr. Profena and I are vetting that. There's a lot of vacations right now, but tentatively we're at Lewis on June 27th. Just some of the things that are going on there. Marketing, they mentioned it. You know, some success stories. We've been really marketing some of our doctors with some very colorful signs and some just gotcha signs. Just, you know, got pain, just pain, question mark, and then our number. Urology, if you notice, it's yellow. Dr. Keller and I met this morning on increasing his business, and he actually, he said, I've never seen anything on that sign before. But when I saw that bright yellow and saw my name up there, he said it was really eye-catching. But we've been really vetting pain management in the digital area into some campaigns, some other campaigns. And over last year, he was up 125%. For the month of May, he was, please forgive me, it was 533%. So we're really trying to grow that too as well, because he does a number of procedures, and that ends our surgical services. So that was really good. General surgery, year to date, it's up 25%. We had a whole campaign in January, February, and March of getting out the message for our general surgeon. And some interesting things is that one of the things I talked to y'all, one of my goals is to work well with others. We all have to play, we all have to cooperate. And so we've been reaching out to the ED here right across the street and the ED in Livernia if they have a critical patient that needs surgery. Don't send them to San Antonio if we have a general surgeon here that can handle the situation. And they got to meet him. Dr. Preston Moorhead actually went with us on several occasions, thanking them. And just a little stat here, January through May of 18, our transfers from those two EDs were at 13. And from January through May of 19, we're at 29. So they're working with us, keeping the people here. They can get visited. The family can visit here too as well. So that's a great thing. Emergency preparedness, I always talk about that every month. This month and next month, we're doing an active shooter training for our staff. Be prepared. You know, the old Boy Scout motto. So we're working with a police officer that out of Sutherland Springs, or is he Wilson County?
Sheriff's Department.
And he's coming here and giving a class, and we'll do some practice active shooters too. A little limited to a certain extent within the hospital, but we're going to be actually practicing some scenarios at a campus site, so that after it's closed, after working hours. ED Satisfaction Action Group, I tell you that's on the forefront. Mandy and I talk about that with Dr. Dunn on a monthly basis, and we have action items every month, and their top box score continues to improve. So I can tell you that's at the forefront. We go over, we're looking at trends, some messages from the staff, actually from the patients on how we can improve. So that was going forth still. Community needs assessment. You know, we did that in January, February timeframe, and we got out and reached out to community members and had them come here and tell us what they felt we needed, some services we needed here, and what we needed to improve on, and also tell us what we did right. So I started reaching out this month to actually bring the groups back together and say, I heard you. Here's what we're doing. These are the areas we're improving on. Have you heard anything else? And reaching out, some of them one-on-one and some of them in groups. So I've done the first stage, and I hope to have that completed by August with all the community members, because I actually want to reach out to each one of them. Scheduling department, I cannot say enough on this too. Larry, thank you for letting me know of a situation that was going on here. If y'all hear something, please let me know. We're establishing process improvement committees on anything that is major, that affects 2 or more departments. And Dr. Profena had one up that we had for surgical services just recently too, and we're working on that process improvement. Any misses, anything that we can learn from, we're gonna do. So scheduling department, it all starts back from the clinic system and the referral department. That referral, we went, I think we've talked about it before, we were basically paper. And going to somebody's desk and seeing referrals from every one of our physicians and trying to manage that, it was a nightmare. It's all electronic now, and so that all goes into our system, gets sent out. We're working on insurance verification. We're It's automated to a system, and anyhow, the scheduling department went from buckets of 200 plus to they're getting everything out within 24 hours. I'm sorry, the referral department. It then goes to their scheduling department to get those things scheduled here, like our imaging, and coordinating that with our radiology department, our lab, or our respiratory. And those have gone to buckets of greater than 250 down to 24 hours to get those patients scheduled. And they're doing really great at it. Because then the ultimate mission is the quality measures, and that's the mammographies and the things, the annual exams, the PSAs for men. After a certain age, that those get called and say, we'd like to schedule you for your annual exam and get those done as quickly as possible. So all these processes are coming to fruition, and I'm very excited to say that we do have some stumbling blocks, but things are coming into fruition through that. Really proud of this one, Brandon and his team, Melinda from laboratory, Todd, clinic system, Norma, anybody else? Abel from radiology. We talked about this about 3 years ago, a Meditech DCW interface that was sold to be done in 6 weeks. So we've got it done. It's live. So right now our physicians are starting to get that. Always slight problems, but everything's coming across, and we're working to fix those little problems. But I think that overall the physicians are pleased that they are now electronically getting their labs and the radiology results almost instantaneous. As soon as they're done in lab, they're there. As soon as as soon as a radiology report is dictated and finalized, it's there. So, and it's in the record where they can find it, and I think that's very important. Next week is quarterly open forums for employee open forums. Keep people updated as to what's going on in their community hospital, and so I'll report on that next month. MOB updates, we've advertised to all the anybody a contractor that wishes to come take bids to do the build out and the MOB. Brandon and I have seen 3 so far, contractors, and gone through those. They're very excited and have lots of questions, and we're working with Mike Hell, our architect, and Carl's helping us out too as well. And so we have 3 more now for next Tuesday, and by July 9th, we will be closing that for an public open bid to look at who is the lowest bidder. And then we'll look at those and detail those out a little bit further. So just want to give you a little update on that. Central and South Campus, Olivia, Brandon, and myself were working together and coming up with a plan for not only where people are going to go during this transition and how we're going to move them. And we would like to move them permanently if at all possible. And those are the first priority, and then those that are going to be temporary, like positions, like Dr. Henley's office will be temporary. He'll move over, and then once it will be build-out's done, he would move back. So we're coming up with a plan to start moving people in July. Dr. First app, we talked about that a little bit in marketing, so I just want to give you some things with the mHealth app and the Dr. First app. Talk a little bit about mHealth, a little out of order here. So Hilo is with our clinic system because we have ECW. Meditech has mHealth. We are working on an API which will align both of those, and those of you who have Google Health, if you have a Google phone, they'll have a Google Health app, and the Apple Health app, it aligns all of it into one, so that it's one app to where everything is going. That should be coming within the next year or 2 as well. So that's some exciting things that are coming, and those are meaningful use criteria that we have to do so we don't get penalized for payment. Dr. First app, some great things on that is it's an app that when you go in, you can actually, the doctor here in the ED gives you a prescription, it goes over, and you can actually track if it's ready. And one of the great things I heard in the ED just last night, because we just went live this week, we called all the patients, was it useful, did it help you? And one of the patients said, not only did I track it, but I saw that there was a benefit program for those who couldn't afford their prescription, and I went into that and I got it approved and I only paid $1.18 for my prescription. You can't beat that. So that was a great win there in just 1 week. So that was exciting. The Hilo app, just to talk about that too, one of the EMS services was there, and they came in and they were talking with Caitlin about one of the patients was brought in, and they said, can you tell me your prescriptions, because they have to do the prescription verification process. And they're like, I can't tell you everything, but let me get you this app. This is all my medication, because I'm seeing the doctor.
Right.
And they were like, oh man, this is beautiful. It tells you everything, exactly the way it is. So that was an exciting thing too, to use those apps. Savannah told you the home health inspection, that was a great win. We did have the one deficiency we told you about. Well, we found the documentation, we sent it in. They came back and put it in as a 0 deficiency for us. So home health made 100%. That was exciting. Our mammography inspection through Abel, and his staff, they got 0
He gets choked up about that.
I get choked up about it. Let me tell you. You know I love Abel. So they had 0 deficiencies in their mammo department. I can't say enough about that, because that is the one area that you do want to make sure that you're doing everything completely right. Our RHC inspections, we have to be certified every 3-4 years? 3 years. So we went through the full certification of all 3 campuses, our South Campus, our North Campus, and our main campus here. We did get 2 deficiencies, which we've already submitted corrective actions, and they've accepted it, and so we passed our RHC. But the main campus here at Dr. Henley's office, I'm very proud they made a 0 deficiency inspection, so that was all outstanding. And then the home health, I showed some of y'all in finance, but this is if you saw home health, and they made quite a bit of money this month for them, and they're up 25% in the rehab department. Those are money makers for us and taking care of patients. And I'm very proud of them. Sue's been working very, very hard, and to come from Warm Springs to Conlin Memorial and everything that we're doing within home health, her team have done an outstanding job, so I'm very proud of them. Last but not least, you know, I showed y'all this last month that we're just showing all of our awards up there. Well, I didn't expect it to happen so soon, but I got to make room. We just got told last week we did get gold on our stroke program. So, wow. I will. Some more gold awards. So that's outstanding from all of our staff. And that concludes my report.
Okay. Do you have any questions for Bob?
Any plans to get a dermatologist?
I've contacted 2 for actually doing some time here.
Okay.
Okay. All right. We're now about to close down the open session, go to executive session. Board of Directors of Wilson County Memorial Hospital District, DPA Conley Memorial Medical Center will now go into closed session. Closed session is being held